Thank you very much, Your Eminence. I've been on and off participating in the activities of the Academy for 10 years now, and I must say that I've always done so with some trepidation. I am an unrepentant politician and diplomat, and therefore, as all politicians and diplomats, I am no expert in anything, and it's one of the problems that you get with politicians. But I'm very glad to be here this afternoon, and indeed, I think, looking down the list of participants, this is clearly one of the most qualified assemblies that the Academy has organized in these years. And so I think, seeing that you've been working now for 3 days or more, a little bit of light relief from the political world and from the world that I operate in probably won't go amiss. At the outset, I wish to express my appreciation to His Eminence Cardinal Peter Turkson, Chancellor of this distinguished Pontifical Academy of Sciences, and to the President, Professor Joachim von Braun, for their kind invitation to join such an esteemed group of experts and policy makers for this workshop. The COVID-19 pandemic brought unprecedented disruption, affecting every aspect of life, globally, nationally, locally, and on a personal level. Its impact left profound and lasting scars across social, economic, political, religious spheres, scars that persist despite the formal end of the pandemic. In my discourse, I first will explore briefly how the Catholic Church and other organizations have sought to address the inequalities the pandemic exposed. I will then reflect on whether we have truly learned from this global crisis. Finally, I will share some perspectives on how to inspire hope and renew efforts to address both ongoing and emerging challenges, emphasizing the necessity of transcending self-interest in favor of the common good. So firstly, addressing inequalities. What stands out most profoundly when reflecting on the global impact of COVID-19, which spanned from late 2019 through 2022, is the sheer scale and depth of the disruption it caused across every conceivable level, internationally, nationally, locally, and even within the intimate confines of families. This was not just a health crisis, it was a social, economic, political, and psychological upheaval of unprecedented proportions. The pandemic upended the daily rhythms of life for hundreds of millions of people around the world, forcing them into lockdowns and quarantines that lasted for months. In many places, entire populations found themselves confined to their homes, unable to go about their usual routines, interact with others freely, or access the basic services they depended on, including religious practices and assistance. The concept of normal life was profoundly altered, with the virus spreading quickly, leaving governments and public health systems scrambling to respond. Economically, the pandemic brought vast sectors of the global economy to a standstill. Supply chains were disrupted, businesses, especially small and medium-sized enterprises, were forced to close or pivot to new models, and entire industries like travel, hospitality, restaurant business, and entertainment were decimated. Unemployment rates surged, and economic inequality was exacerbated, as many people faced job losses, while others were able to adapt to remote work or continue their professional lives with relative ease. This sudden and severe economic contraction had cascading effects, impacting everything from personal finances to global trade, and creating a ripple effect of instability across nations. Politically, the pandemic forced many governments to postpone or alter essential civic activities, including elections, public consultations, and even legislative processes. On a local level, the pandemic had a deep and lasting impact on everyday life. Schools, one of the most critical pillars of society, faced massive disruptions. In many places, education was abruptly shifted to online platforms, a transition that highlighted the digital divide and exacerbated existing inequalities, as students from lower income families often lacked the resources, technology, or stable internet connections necessary to engage in remote learning. For an entire generation of children and students, the shift to virtual classrooms, or in some areas, the complete absence of formal education for extended periods, had lasting consequences on their academic development, socialization, and mental health. Concerns remain with regard to a lost generation of learners and the long-term educational impact on young people. Even within the family unit, the pandemic imposed profound changes. Families found themselves living in close quarters for extended periods, which created both challenges and opportunities. At the same time, churches halted or limited their liturgical services. Indeed, the pandemic represented a singular global event that affected nearly every aspect of life, tearing down the usual structures and forcing individuals, families, communities, and governments to find new ways of coping with unprecedented challenges. The poignant images of Pope Francis standing alone in St. Peter's Square on the 27th of March 2020 remain deeply etched in our collective memory. Against the backdrop of an empty and rain-soaked piazza, a stark representation of the isolation and fear gripping the world during the early days of the COVID-19 pandemic. His voice echoed Christ's message of hope and faith. Why are you afraid? Do you still not have faith? This profound spiritual appeal reminded the faithful that in times of crisis, faith must guide us through uncertainty, much like the disciples in the storm-tossed boat who were urged to trust even amidst chaos. The image of the solitary figure of the Pope carrying the world's burdens in prayer became a symbol of hope and a reminder of the transformative power that faith has to sustain and guide us through the darkest hours. On the 5th of May 2023, with great hope, the Director General of the UN World Health Organization, Dr. Tedros Ghebreyesus, declared an end to the COVID-19 public health emergency. At the same time, he stressed that such a declaration does not mean the disease is no longer a global threat. Indeed, we must remember that at least 7 million people continue to be directly affected by this disease, a figure that is likely underestimated. Beyond these numbers, the pandemic has left deep and lasting scars on entire generations, affecting their emotional and psychological well-being in profound ways. In fact, the COVID-19 pandemic and the measures implemented to contain its spread have left profound social scars, extending far beyond the immediate health crisis. Among the most evident scars are the profound feelings of isolation, widespread division, and heightened polarization within communities. Measures like lockdowns, quarantines, and restrictions on gatherings, while necessary to curb the virus's spread, disrupted the fabric of social life, severing connections between families, friends, and broader community networks. These disruptions, at times applied in an arbitrary or excessive fashion, not only caused loneliness, but also weakened the social cohesion essential for a collective resilience. The pandemic also became a fertile ground for political instrumentalization, as debates over public health measures such as vaccines and mask mandates often devolved into ideological disputes. This polarization deepened existing societal fractures and fueled mistrust in institutions, further dividing people along political and cultural lines. The resulting fragmentation has left many societies struggling to find unity, even as the acute phase of the pandemic has receded. At the same time, the spiritual and psychological toll of the pandemic cannot be underestimated. The closure of places of worship removed vital sources of spiritual support at a time when people were grappling with uncertainty, grief, and fear. For many, the inability to participate in communal prayer or religious rituals compounded feelings of alienation. Similarly, the psychological strain manifested in increased anxiety, depression, and emotional fatigue was exacerbated by the prolonged and constant backdrop of uncertainty. Learning from the crisis. Nevertheless, when we look at our world today, a couple of years after those events, it is striking to observe how we tend, or perhaps even try, to forget those moments, as if they never existed. It is also important to note that our societies are not particularly more prepared today than they were 5 years ago to deal with future pandemics, nor is the international context any more united or peaceful. During the height of the pandemic, Pope Francis shared a profound reflection on the transformative potential of crises. Addressing the participants in the plenary assembly of the Pontifical Academy for Life, he emphasized that crises do not leave individuals or societies unchanged. He remarked that we do not emerge from a crisis the same. We will either emerge better or we will emerge worse, but not the same. The change is in our hands. This statement underlines the pivotal role of the decisions made during such turbulent crises in determining whether such crises lead to growth or decline. Indeed, if we fail to critically evaluate the causes, management, and consequences of the COVID-19 pandemic, we would miss a significant opportunity to learn from one of the most defining crises of our era. The pandemic exposed systemic weaknesses across multiple sectors, from healthcare to governance, and amplified pre-existing societal inequalities. Without rigorous scrutiny of our actions, both successes and failures, we risk repeating the same mistakes in future crises. It is crucial to draw lessons not only about how to improve public health infrastructure and crisis management, but also to address the disparities that the pandemic brought to light. In primis, the pandemic, among other things, has highlighted how access to health services, in particular the administration of vaccines, is highly asymmetrical, with richer countries being able to stockpile millions of such drugs, exceeding their actual needs, when in many developing countries it has been difficult to secure even the first dose. In fact, UNDP figures show that while 80% of people living in high-income countries had been vaccinated with at least one dose by the end of November 2023, the equivalent figure for low-income countries stands at 33%. Similarly, in high-income countries, the average increase in health expenditures required to cover the vaccination of 70% of the population was less than 1%, whereas to achieve the same target in low-income countries, the average required increase was 57%. Even if the mentioned statistics may appear shocking, we should also acknowledge the tremendous efforts made by several countries, organizations, and individuals to provide for fairer access to vaccines. In this regard, the significant efforts by the Holy See and the Catholic Church in loco, though on a limited scale, may serve as an example. For instance, in May 2021, Pope Francis decided to offer COVID-19 vaccinations not only to the Vatican personnel, but also to the homeless people sheltering near St. Peter's Square. Some 300 persons accepted this offer and were vaccinated in the Paul VI Audience Hall. Other 1,400 persons received their vaccination in the Mother of Mercy clinic that is operated under the colonnade of St. Peter's Basilica. In the same way, the Office for Papal Charities conducted a fundraising campaign called Suspended Vaccine, similar to the Italian custom of paying extra for coffee in local coffee bars so that the poor persons could benefit from these suspended coffee donations without having to pay for the coffee. In this way, the Suspended Vaccine campaign was able to assist the Catholic Church in India, Syria, and elsewhere, providing for the needs of the most vulnerable persons affected by the pandemic in their respective countries. In this regard, it is also worth noting the case of Vietnam, a country with which the Holy See does not currently have diplomatic relations. During the pandemic, in so many other places around the world, the country was struggling to provide adequate health care to the vast number of patients in need. Despite only representing 8% of the population in Vietnam, Catholic institutions, including religious congregations and diocesan centers, opened their doors to provide beds for the sick. In a gesture of solidarity, Pope Francis contributed 100,000 euros, which, together with a similar contribution from the Episcopal Conference of Vietnam, was used to purchase vaccines for the poor. Indeed, the outpouring of generosity on the part of the Catholic Church greatly impressed the Vietnamese authorities, and it was one of the factors that led to the establishment in Hanoi of the office of the resident papal representative in Vietnam. Moreover, the Holy See has actively taken part in the processes pertaining to the revisions in the international health regulations, to which it became a state party in 2007, as well as in the creation of an international legal instrument on pandemic preparedness and response. In this regard, the Holy See declared that it commends the efforts of states, with the support of the WHO Secretariat, to undertake these two historic processes aimed at strengthening cooperation and making equity and solidarity a reality. While much consensus has been built during the long and intense negotiations of the past few months, no effort should be spared to further build agreement to meet the challenges. Nevertheless, it is essential to maintain the efforts made so far, recognizing that failure in this endeavor would affect mostly the poor and those in vulnerable situations. On a more local ecclesiastical level, one must not fail to recognize the extraordinary efforts made by numerous dioceses, parishes, and religious congregations around the world during the pandemic. These efforts demonstrated a profound commitment to service and compassion. Hundreds of hospital chaplains worked tirelessly to offer spiritual support to patients, sometimes at great personal risk to their own health. Their presence in hospitals, often at the front line of the crisis, was not only a source of comfort, but also a symbol of solidarity with the suffering. And it comes to my mind now that the Diocese of Bergamo in northern Italy lost during the COVID crisis over 40 priests, many of whom were assisting the sick. In a particularly notable example, nuns across Africa dedicated themselves to the urgent task of facilitating the administration of COVID-19 vaccines. These women worked relentlessly, organizing vaccination campaigns, educating community, and helping to dispel widespread myths and misconceptions surrounding the vaccines. Their work was instrumental in building trust within local communities, where there was often significant skepticism about the vaccine due to misinformation and cultural factors. These nuns truly played a key role in saving countless lives. We should also mention the enormous effort made by the United Nations, governments and private partners through the COVAX project, which was able to coordinate the provision of 2 billion doses of vaccines to 146 countries, having saved the lives of an estimated 2.7 million people. This program raised over $2 billion for the procurement of the vaccine as early as November 2020, and in January 2021, 39 days after the first COVAX doses were administered in a high-income country, the first doses were administered in a low-income country. Thirdly, beacons of hope. These are but a few concrete efforts conducted by various actors aimed at decreasing inequalities and providing hope in a time of great despair. On the threshold of the Jubilee year of 2025, with hope as its overarching theme, I believe that these efforts, however limited they may have been, can serve as an example of how we can all contribute to reducing inequalities, thereby offering a new perspective of hope. If we limit ourselves to negative criticism of the efforts done by so many individuals, organizations, and even governments, we run the risk of causing more harm and escalating the cynicism and disappointment that are already rife in our communities. In this light, the Holy Father, in the bull of induction of the Jubilee, reminds us of the risk of adopting a defeatist perspective, stating that before the constant tide of new forms of impoverishment, we can easily grow inured and resigned. Yet we must not close our eyes to the dramatic situation that we now encounter all round us, not only in certain parts of the world. In an effort to counteract this widespread and fatalistic attitude, the Holy See continues to call on governments, international organizations, and all persons of goodwill to build on the successes of the previous decades, which have allowed the number of people living in extreme poverty to drop by 66% between 1990 and 2019. Such progress was made possible by reinforcing the multilateral system, which recognizes that the biggest challenges for humanity transcend national borders and require a unified, cooperative approach. By fostering collaboration through international institutions, nations have effectively pooled resources, knowledge, and strategies to combat poverty and other global issues. Strengthening multilateralism has enabled the implementation of coordinated policies, ranging from sustainable development initiatives to international aid programs, showcasing the power of shared commitment in addressing complex problems. These previous successes, in my opinion, should not be taken for granted, but rather serve as a foundation for renewed efforts to tackle persistent and emergent challenges. In this regard, multilateralism remains essential for addressing global crises, whether they relate to poverty, health, or the environment. Nonetheless, Pope Francis stated in his address to the diplomatic corps accredited to the Holy See in 2019, an indispensable condition for the success of multilateral diplomacy is the goodwill and good faith of the parties, their readiness to deal with one another fairly and honestly, and their openness to accepting the inevitable compromises arising from disputes. Whenever even one of these elements is missing, the result is a search for unilateral solutions, and in the end, the domination of the powerful over the weak. Indeed, it is only by continuing to prioritize collective action and solidarity that the international community can build upon the momentum achieved in previous decades for the good of future generations. Another vital step in reducing inequality is to reconsider the current financial systems. In his recent address at COP29 in Baku, the Holy Father specifically mentioned this crucial step, stating that it is essential to seek new international financial architecture that is people-centered, bold, creative, and based on the principles of equity, justice, and solidarity. This reform is indispensable for equipping developing countries with the means to address the multifaceted daily challenges ranging from climate change and environmental degradation to increased health vulnerabilities. Beyond immediate adaptation tools, these reforms are essential for enabling governments to secure resources that ensure fair and universal access to healthcare. While the private sector plays a significant role, especially when aligned with the pursuit of the common good, it cannot replace public health systems. Public health infrastructure is uniquely positioned to prioritize equity and inclusivity over profit, ensuring that essential services reach even the most disadvantaged communities. Relying solely on private entities risks creating gaps in access, as market-driven approaches may not address the needs of vulnerable populations. Therefore, a balanced partnership between public and private sectors is necessary, where public institutions maintain a foundational role in safeguarding health as a universal right. In conclusion, the pressing challenges of our time, whether health, environmental, social, or economic, can only be addressed through genuine openness to others, which transcends self-interest. This responsibility is not solely that of others or institutions. Each of us bears a unique duty to act, starting within our immediate spheres of influence. Viewing these challenges as distant or irrelevant diminishes our sense of accountability and undermines the interconnected nature of today's globalized world. The COVID-19 pandemic has definitely shown us that a comprehensive commitment from the international community is indispensable to ensure equal access to essential medical care and vaccines, especially since universal healthcare remains a distant reality for many regions. Furthermore, learning from this recent past experience, governments and private entities must demonstrate a sense of responsibility, coordinating responses at every level, local, national, regional, and global, through new models of solidarity to strengthen the capabilities of the most vulnerable countries. In particular, as nations work to establish international instruments on pandemic preparedness under the World Health Organization, it is imperative that a policy of generous sharing guide efforts to ensure universal access to diagnostics, vaccines, and treatments. Additionally, allow me to reiterate Pope Francis' appeal so that institutions like the World Trade Organization and the World Intellectual Property Organization adapt their legal frameworks to prevent monopolistic practices that hinder global healthcare access. It is only by embracing this shared responsibility with humility and determination that we affirm our role as stewards of a more inclusive, just, and sustainable world for all. In fact, Pope Francis reminds us in Fratelli Tutti of the specific roles of governments and other forms of social organization in this regard, saying, "Thank God so many aggregations and organizations of civil society help to compensate for the weaknesses of the international community, its lack of coordination in complex situations, its lack of attention to fundamental human rights and to very critical situations of certain groups." Thus, the principle of subsidiarity, which guarantees the participation and action of smaller communities and organizations, which complement the action of the state, takes on concrete expression. Many times they carry out praiseworthy efforts with the common good in mind, and some of their members go so far as to perform truly heroic deeds, which show how much beauty our humanity is still capable of. Thank you for your attention and engagement over these 2 days. I am confident that the collective knowledge and expertise shared during this workshop will lead to meaningful actions and positive outcomes, not only within the Catholic Church, but also in the broader fabric of society. Thank you very much.